Did you know that right now, as you're watching this video, your blood pressure could be silently setting you up for a stroke, heart attack, or sudden death, and you might be completely focused on the wrong number? I'm talking about those two numbers your doctor reads off, the top one and the bottom one. And here's what most people over 60 don't realize. One of these numbers is far more dangerous than the other, but which one depends on your age, your health history, and what's actually happening inside your arteries right this second. My name is Dr. Laura, and as a senior health educator who's spent over 2 decades working with older adults, I've seen too many people suffer preventable strokes and heart attacks because they misunderstood their blood pressure readings. So today, I'm going to explain exactly what those two numbers mean, which one poses the greatest threat to your life, and most importantly, what you can do starting today to protect yourself without necessarily needing more medication. Now, before we dive deep into this life-saving information, do me a quick favor, hit that subscribe button and turn on notifications, because I release new videos every week specifically designed to help people over 60 live longer, healthier, and stronger lives. And if you find this information helpful, please hit the like button, because it helps YouTube show this video to more seniors who desperately need this information. All right, let's talk about blood pressure. And I promise to make this simple and clear because your life might literally depend on understanding this. When you get your blood pressure checked, you see two numbers, let's say 145/90, and that top number, the 145, is called your systolic pressure, while that bottom number, the 90, is called your diastolic pressure. Now here's what those numbers actually mean in plain English. Your systolic pressure, that top number, measures the force of blood against your artery walls when your heart beats and pushes blood out. So think of it like a water hose when you first turn on the faucet. There's a surge of pressure as the water rushes through. Your diastolic pressure, that bottom number, measures the pressure in your arteries when your heart is resting between beats. So it's like the steady background pressure in that water hose when the faucet is just barely open. For decades, doctors believed that the bottom number, the diastolic pressure, was actually more important, especially for predicting heart attacks and strokes. And this belief dominated medicine from the 1960s all the way through the 1990s. In fact, if you're over 70, you probably remember when doctors would focus almost entirely on that bottom number and barely mention the top one. But here's where medical science completely changed direction, and this is crucial information that could save your life. In the year 2000, a massive study called the Framingham Heart Study, which followed over 5,000 people for decades, discovered something shocking. For people over 50 years old, that top number, the systolic pressure, is actually far more dangerous and a much better predictor of heart disease, stroke, kidney failure, and death than the bottom number. Let me tell you about Margaret, a 68-year-old woman I worked with 3 years ago who came to me feeling perfectly healthy with a blood pressure reading of 165/75. And like many seniors, she wasn't too concerned because her doctor had told her years ago that the bottom number was the important one. And hey, 75 wasn't that high, right? Wrong. Margaret's systolic pressure of 165 was dangerously elevated, and within 6 months of our first meeting, she suffered what we call a hemorrhagic stroke. A blood vessel in her brain burst from the constant high pressure, and while she survived, she lost mobility on her left side, and her speech was never quite the same. This happened because she, like millions of other seniors, didn't understand that isolated systolic hypertension, when your top number is high but your bottom number is normal or even low, is extremely common after age 60 and incredibly dangerous. Here's why the systolic pressure becomes so dangerous as we age. As you get older, your arteries naturally become stiffer and less elastic, kind of like an old rubber band that's lost its stretch. And when your arteries are stiff, every time your heart beats and pumps blood, there's a much bigger surge in pressure because those rigid arteries can't expand and absorb the force like they used to. This constant pounding of high-pressure waves damages the delicate inner lining of your blood vessels, creating tiny tears and rough spots where cholesterol and calcium can build up, forming those deadly plaques that can rupture and cause heart attacks. And it also dramatically increases your risk of something even more terrifying, an aortic aneurysm, which is when the main artery leading from your heart starts to balloon out like a weak spot on a tire. And if that aneurysm bursts, you've got maybe minutes to live, with a survival rate of less than 20%, even if you're already in a hospital. The Framingham study showed that for every 20-point increase in systolic blood pressure above 115, your risk of dying from heart disease or stroke doubles. Let me repeat that because it's critical. Doubles with every 20 points. So if you're walking around with a systolic pressure of 155 or 165 or 175, you're playing Russian roulette with your life every single day. Now, if you want to grab my free blood pressure numbers guide that breaks down exactly what every reading means for your age and health status, I'll put the link in the description below. It's completely free, no credit card required, and it includes a simple chart you can print out and keep by your blood pressure monitor at home. But now let's talk about that bottom number, the diastolic pressure, because I don't want you thinking it doesn't matter at all. It absolutely does matter, just in different ways and for different people. Your diastolic pressure is crucial because it represents the pressure in your arteries when your heart is supposed to be resting and refilling with blood. And if that pressure is too high, it means your heart never gets a proper rest. Imagine trying to sleep in a room where someone's constantly shaking your bed. That's what high diastolic pressure does to your heart. When your diastolic pressure stays elevated, usually anything over 90, it forces your heart muscle to work harder 24 hours a day, 7 days a week, with no break, and over time this causes your heart muscle to thicken and enlarge in a condition called left ventricular hypertrophy, which sounds technical but basically means your heart is bulking up like a bodybuilder, except this isn't healthy muscle. It's stiff, oxygen-starved tissue that can't pump efficiently. Let me share Robert's story. He was 62 when I first met him, a former construction worker who prided himself on being tough and never complaining, and his blood pressure readings were consistently around 140 over 105. So yes, both numbers were elevated, but that diastolic pressure of 105 was seriously high. Robert told me he'd been having episodes where his heart would race and pound so hard he could feel it in his throat, and he'd wake up at night short of breath, but being a typical man, he figured it would just go away on its own. When we finally convinced him to see a cardiologist and get an echocardiogram, which is an ultrasound of the heart, the results were alarming. His left ventricle had thickened so much that it was only pumping at about 45% efficiency instead of the normal 55 to 70%, and he was in the early stages of heart failure, meaning his heart was literally failing to pump blood effectively to his body. The cardiologist told Robert that if he'd waited even another year without treatment, he likely would have needed a heart transplant or wouldn't have survived. Now here's something fascinating and terrifying that most people don't know. High diastolic pressure is especially dangerous for people under 50, and research published in the Journal of the American College of Cardiology in 2019 found that young and middle-aged adults with isolated diastolic hypertension, where the bottom number is high but the top number is normal, have a significantly increased risk of heart attack and stroke, sometimes even higher than people with isolated systolic hypertension. But as you age past 60, isolated diastolic hypertension becomes much less common, and instead you're more likely to develop that isolated systolic hypertension we talked about earlier, or you might have both numbers elevated, which is the most dangerous situation of all. There's also something called pulse pressure that very few people talk about but is incredibly important. Pulse pressure is simply the difference between your systolic and diastolic numbers. So if your blood pressure is 150 over 70, your pulse pressure is 80. And here's what you need to know. A pulse pressure greater than 60 is considered high and indicates stiff, aging arteries, while a pulse pressure greater than 80 is a red flag for serious cardiovascular disease and dramatically increases your risk of heart attack, stroke, and death. I worked with Dorothy, a delightful 73-year-old retired teacher who came to me with blood pressure readings of 170/65. Now at first glance, some people might think, well, that bottom number looks pretty good. But her pulse pressure was 105, which was dangerously high and indicated her arteries had become extremely stiff and damaged. Dorothy had been experiencing occasional dizzy spells, especially when standing up quickly, and she'd actually fallen twice in the past month, which is what finally prompted her daughter to insist she see someone. Those dizzy spells were happening because her diastolic pressure of 65 was actually too low to properly perfuse blood to her brain when she changed positions, while that skyrocketing systolic pressure of 170 was damaging her blood vessels with every heartbeat. She was caught in a dangerous situation where both extremes were hurting her. After we implemented a comprehensive plan, including specific medications that would lower her systolic pressure without dropping her diastolic too low, along with dietary changes and gentle exercise, her blood pressure stabilized at a much safer 135/70. Her dizzy spells disappeared, and she's now 76 and hasn't fallen once in 3 years. Now let me give you some practical numbers to remember. According to the American Heart Association and the American College of Cardiology, normal blood pressure is less than 120/80. Elevated blood pressure is 120 to 129 systolic with diastolic less than 80. Stage 1 hypertension is 130 to 139 systolic or 80 to 89 diastolic, and stage 2 hypertension is 140 or higher systolic or 90 or higher diastolic. However, and this is a huge however, for people over 65, especially those over 75 or 80, these targets might need to be adjusted because taking blood pressure too low can actually be dangerous. Research from the SPRINT trial showed that getting systolic pressure below 120 in older adults significantly increased their risk of falls, fainting, kidney damage, and even death in some cases. This is why I always tell my clients, blood pressure management is not one size fits all, especially for seniors. And you need to work with a doctor who understands that what's right for a healthy 45-year-old is very different from what's right for an 80-year-old with multiple health conditions. Now let's talk about what you can actually do about high blood pressure, whether it's your systolic, diastolic, or both numbers that are elevated. And I'm going to give you specific, actionable strategies that have been proven to work in clinical studies. First, let's address sodium intake, because this is still one of the most powerful tools we have. The average American consumes about 3,400 milligrams of sodium per day, but the American Heart Association recommends no more than 1,500 milligrams for most adults, especially those with high blood pressure, and reducing your sodium intake to that level can lower your systolic blood pressure by 5 to 6 millimeters of mercury and your diastolic by 2 to 3 millimeters, which might not sound like much, but remember, every 20-point reduction in systolic pressure cuts your cardiovascular death risk in half. The challenge is that about 70% of the sodium in our diet comes from processed and restaurant foods, not from the salt shaker on your table, so you need to become a label detective. Start reading nutrition labels and looking for items with less than 140 milligrams of sodium per serving. Avoid canned soups and vegetables unless they're labeled no salt added. Limit deli meats and cheese, which are sodium bombs. And when you eat out, ask for sauces and dressings on the side because restaurants typically use way more salt than you'd ever use at home. Second, you need to increase your potassium intake because potassium helps your kidneys flush out excess sodium and also helps relax your blood vessel walls. The recommended daily intake is 2,600 milligrams for women and 3,400 for men, but most Americans only get about half that amount, and studies show that increasing potassium intake can lower systolic blood pressure by 3 to 5 points. Great sources of potassium include bananas, which have about 420 milligrams, potatoes with skin, which have around 900 milligrams, spinach, which provides about 840 milligrams per cooked cup, avocados with roughly 700 milligrams per fruit, and white beans, which pack an impressive 1,000 milligrams per cup. However, if you have kidney disease, you need to be careful with potassium and should consult your doctor before significantly increasing your intake. Third, you've got to move your body regularly. And I know you've heard this a million times, but hear me out because the specific type and amount of exercise matters tremendously for blood pressure. The gold standard is a 150 minutes per week of moderate intensity aerobic activity, which breaks down to just 30 minutes 5 days a week. And this can include brisk walking, swimming, cycling, dancing, or even vigorous yard work. And research shows this level of activity can reduce systolic blood pressure by 5 to 8 millimeters and diastolic by 2 to 5 millimeters. But here's what's even more exciting. Recent studies have found that adding just 2 days per week of resistance training, meaning exercises with weights, resistance bands, or even body weight, can provide additional blood pressure benefits of 3 to 5 millimeters. And unlike aerobic exercise, which mainly affects blood pressure during and shortly after the workout, resistance training creates muscle that continues to help regulate blood pressure 24/7. I had a client named George, 71 years old, who'd been completely sedentary for a decade after retiring from his accounting job, and his blood pressure was averaging 162/94, despite being on 2 medications. We started him on a simple walking program, just 10 minutes 3 times a day after meals, which is easier for many seniors than trying to do 30 minutes all at once. And within 8 weeks, his average blood pressure had dropped to 148/86. And after 6 months of gradually increasing his activity and adding light dumbbells twice a week, he was down to 136/78, and his doctor was able to reduce one of his medications. Fourth, you need to address your weight if you're carrying extra pounds, because every kilogram, that's about 2.2 pounds, that you lose can reduce your blood pressure by approximately 1 millimeter of mercury. So if you're 20 pounds overweight and you lose that weight, you're looking at a potential reduction of about 9 to 10 points in both systolic and diastolic pressure. That's often enough to get someone from stage 2 hypertension down to stage 1, or even just elevated blood pressure, which dramatically reduces their cardiovascular risk. Fifth, limit alcohol consumption, because while 1 drink per day for women or 2 for men might have some cardiovascular benefits, anything beyond that raises blood pressure significantly, and binge drinking, even occasionally, can cause dangerous spikes. If you're currently drinking more than the recommended amounts and you cut back to moderate levels, you can expect to see your blood pressure drop by about 4 millimeters systolic and 3 millimeters diastolic. Sixth, manage your stress, because chronic stress keeps your body in a constant state of fight or flight, which means stress hormones like cortisol and adrenaline are constantly circulating and keeping your blood pressure elevated. Techniques like deep breathing exercises, meditation, yoga, tai chi, or even just spending time in nature have all been shown to lower blood pressure. And one study found that people who practiced slow, deep breathing for just 15 minutes a day reduced their blood pressure by an average of 5 millimeters systolic and 2 millimeters diastolic within 8 weeks. Seventh, make sure you're getting enough quality sleep, because poor sleep and sleep apnea are major contributors to high blood pressure. People who regularly sleep less than 6 hours per night have significantly higher blood pressure than those who get 7 to 9 hours. And if you have untreated sleep apnea, where you stop breathing repeatedly during the night, your blood pressure can be 10 to 20 points higher than it should be. And getting a CPAP machine to treat sleep apnea often leads to dramatic improvements in blood pressure control. Now, before we wrap up, let me address the elephant in the room: medication. Many people are terrified of starting blood pressure medication because they've heard horror stories about side effects, or they believe it means they've failed somehow. But here's the truth. If your blood pressure is consistently in the stage 2 hypertension range, meaning 140/90 or higher, and especially if you're over 60 with other risk factors like diabetes, previous heart attack or stroke, or kidney disease, you almost certainly need medication, at least initially, because the damage that high blood pressure does to your organs while you're spending months trying to lower it naturally is often irreversible. Think of blood pressure medication as a tool, not a life sentence. It's buying you time and protecting your organs while you implement those lifestyle changes we talked about. And many of my clients have been able to reduce or even eliminate their blood pressure medications once they lost weight, changed their diet, started exercising regularly, and addressed their stress. But they needed that initial protection to prevent a heart attack or stroke while making those changes. If you're already on blood pressure medication, never, ever stop it suddenly without talking to your doctor, because abrupt withdrawal can cause a dangerous rebound spike in blood pressure that could trigger a stroke or heart attack. Always work with your physician to gradually taper medications if your blood pressure has been well controlled and you've made significant lifestyle improvements. Let me also mention a few supplements that have genuine evidence for blood pressure reduction. Magnesium glycinate, which can lower blood pressure by about 3 to 4 millimeters, and also helps with sleep and muscle relaxation. Fish oil with EPA and DHA omega-3 fatty acids, which can reduce blood pressure by 2 to 3 millimeters and also reduces inflammation. And CoQ10, which some studies suggest can lower systolic blood pressure by up to 11 millimeters in people who are deficient. However, always check with your doctor before starting supplements, especially if you're on blood thinners or other medications, because there can be interactions. Now let me give you the bottom line answer to our original question. Which blood pressure number is more dangerous? The answer is, it depends on your age. If you're under 50, that bottom number, your diastolic pressure, is generally more predictive of cardiovascular problems, and you should be particularly concerned if it's consistently over 80 or 85. If you're over 50, especially over 60, that top number, your systolic pressure, becomes far more important and more dangerous, and you should be very concerned if it's consistently over 140, and especially worried if it's over 150 or 160, because you're in serious stroke and heart attack territory. However, both numbers matter, and the ideal situation is to have both numbers in a healthy range, systolic under 130 and diastolic under 80 for most people, with some adjustments for those over 75 or with multiple health conditions who might do better with slightly higher targets like systolic 130 to 140 to avoid the risks of going too low. The most important message I want you to take away from this video is this. Don't ignore your blood pressure readings. Don't focus on just one number while ignoring the other. Don't delay getting treatment if your pressure is high. And don't underestimate the power of lifestyle changes to dramatically improve your numbers and your health. Every single day that you walk around with uncontrolled high blood pressure, you're rolling the dice with your life. You're damaging your brain, your heart, your kidneys, your eyes, and your blood vessels. And that damage is often silent and invisible until suddenly it's catastrophic and irreversible. I've seen too many seniors suffer preventable strokes that left them unable to speak or walk. Too many sudden heart attacks that took someone's husband or wife or parent without warning. Too many people on dialysis because their kidneys were destroyed by years of uncontrolled blood pressure. And it breaks my heart because in most cases, it didn't have to happen. Before I let you go, I want you to do me 3 quick favors. First, if you found this video helpful and informative, please hit that like button, because it tells YouTube to recommend this video to other seniors who desperately need this life-saving information. Second, make sure you're subscribed to this channel with notifications turned on, because I release new videos every week covering the most important health topics for people over 60, from heart disease to diabetes to arthritis to nutrition and everything in between, and I promise to always give you evidence-based information without hype or nonsense. And third, I'd love to hear from you in the comments. Tell me your age and where you're watching from. Let me know what your blood pressure situation is like. And if you have any questions about anything I covered in this video, drop them in the comments and I'll do my best to answer everyone. Remember, knowledge is power, but only if you act on it. So take what you learned today, check your blood pressure if you haven't recently, talk to your doctor if your numbers are high, and start making those lifestyle changes that can add years to your life and life to your years. Thank you so much for watching, and I'll see you in the next video where I'm going to reveal the 5 worst supplements that seniors over 60 should never take because they can cause serious kidney damage and bleeding. You won't want to miss it, so make sure you're subscribed. Take care, stay healthy, and remember that it's never too late to take control of your blood pressure and your health.